Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test. And this one is for the knee. It is McMurray's test. You know, that test that we all learned back in PT school, we hear so much about, that you look for meniscal tears. But the history of this test, it was first written about back in 1928 by Dr. Thomas Porter McMurray. And he came up with this test as a way to distinguish between meniscal tears and periarticular strains. And if you're wondering what periarticular strains are, it's just strains of the soft tissue. So the muscles, ligaments, the tendons, that stuff around the joint. Now, it is said that meniscal tears do have other symptoms that go along with it, you know, things like locking, the inability to straighten the knee, the pain on palpation with a varus strain. But Dr. McMurray was big on saying that to diagnose a meniscal tear that you need to manipulate the knee in a way to produce symptoms. So he was because again, they didn't have imaging at that time. So he said, hey, let's use this test, be a way to kind of diagnose meniscal tears. But anyway, let's get in on how to do it. To perform this test, you're going to have the patient laying down. Now, I want to talk about how this test has actually changed over the years. There was one description in the beginning, it changed, and then it's kind of changed to how we do it now. So in 1928, Dr. McMurray explained it this way. So the person is, you flex their knee where their heel is to their buttocks or nearly to it. You grasp the knee, holding on to just like the joint line. Holding the ankle with the other side, you're just going to rotate the ankle in and out. So as you see, it's kind of turning that knee joint. And so in that original one, it wasn't actually pain that you were looking for, but a click. So that either you could hear a click or that you could feel a click in the knee. Now, like I said, it changed. So in 1942, Dr. McMurray changed a little bit on there. So he added some of the movement of it. So he said with the alternation of flexion of the knee, you're testing the whole meniscus, so the posterior to anterior. So you actually have performed the test twice, as he explains it. So you do with an internal rotation of the foot to check the lateral meniscus, so that same thing of flexing it and feeling that, and then you turn it out and you're checking the medial, doing the same thing, bringing it up. And he did say around then, that's when the pain came into it. So of course the click, but also a pain. Now, more current in how we are taught about it now, because like I said, it's changed over. What you do is that you have the person's knee up in this full flexion here, and you're gonna hold the knee and the ankle. So you got that holding there. To check the medial meniscus right there, you're going to have that knee, again, flex there. Rotate the foot out. You're applying a valgus force, so pushing in, and then you straighten the knee. So bringing that all the way in like that, bringing that down through here. To check the lateral, you do the opposite. So here, internally rotate, a varus, and extend out. And once again, a positive for this one is a production of pain, or you get the clicking with doing that. So that is how you do McMurray's test. So getting in on the research for this test, I want to find systematic reviews. I kind of find that's a little bit better because you can grab all this information and we can really, really look at it. Because if you just look at individual articles, they're only looking at like maybe 50 people, maybe 300 people, maybe 1,000 people, maybe 10 people. So those numbers can be all over the place. But if you get a systematic review, hey, okay, we're looking at a large number of people over all of these other papers, and so we can possibly get a better idea. Now, the most recent one I could find was from 2008, and they were looking at comparing the McMurrays, the Apleys, and joint line tenderness. And so they just pulled all these studies together, and they found that the sensitivity of the McMurray test was 55%, with a specificity of 77%. So not super great. They were saying that the joint line tenderness was actually much more sensitive. Now, They have done some recent ones. If you're talking about, well, Matt, that was almost 20 years ago. Well, they did one in 2025 in which they were comparing some of the same things. So Thessaly's, which we've done in the past, McMurray's and the joint line tenderness to an MRI. Perform it, see whatever you got, do the MRI, see if that confirms it. Now, this one got pretty interesting because it was looking at the diagnostic ability for like medial and lateral meniscal tears, which this can test both of them to see, which one may be a little bit better. So the sensitivity for the medial meniscus on using this was 75% and 60% for the lateral. So the specificity was a little bit flipped. So it was 60% for the medial and 70% for the lateral. So it was kind of interesting. It almost kind of, like I said, kind of flipped for them there. So that was kind of interesting. But I will say, if you really start looking through a lot of the research, it says that this test really just shouldn't exist in isolation, which is a very common thing that has said that these tests often just don't exist by themselves. It works a little bit better if you kind of group them with other tests. And I will say, it looks like for the meniscus, the joint line palpation seems to be one of the better ones if it's ever compared to any of the other tests. It always seems to kind of come out like a little bit more ahead. But anyway, that is McMurray's test. Do you use it in your knee screening? Do you like it? Let me know. Let us know down in the comments. Of course, if you enjoy the video, please hit the thumbs up button. Mateo appreciates it so much. And as Mateo also always says, take care of yourself. Take care of your patients. We'll see you next time.